the only thing that can jump your GT scores is maintaining the wrong writing. Because many times we see the GT questions are repeated, and repeatedly we do mistakes. That we can only identify the wrong writing. My rank in May INI was 4,000. From November INI 1,002, I dropped to 4,000. So that was a bit disturbing for me. And then I came across Salaah Spotlight. There was Akhil Tambe's third session. He jumped from a rank of 3,500 to rank 6 or 12 in NEET. And there also I asked him how to review the GTs. And that was very helpful.
You had a very bad rank last year. So what was your strategy?
Even the last 3-4 months, it was very difficult to revise. But then that is the challenge. That I have to read same things over and over again and keep testing myself. So my aim was to give any test that is available to me. And my only purpose was to focus on the study only. And I have to improve my GT scores only. Most of the subjects which I felt weak, they eventually became clear once I went through the entire subject. Not doing previous questions, not doing that rapid revision note. I went overall through a subject and got a good wiring in my brain. First, to trust the source you're reading. Then I will go to again for GTs. I'll see that it's not improving. Then maybe my source is a little bit wrong.
What does it take to go from a 30,000 to All India rank 345 in just 1 year? This is the story of Dr. Piyush Mishra, a government medical college graduate and post-intern. From 20K, 30K in INIC to finally breaking into the top 400 in NEET PG 2025. His journey is a lesson in resilience. I am Dr. Sagar Push. In this series, we bring you the stories of doctors who refuse to give up. Today, let's hear how Piyush turned setbacks into spectacular comeback. Hello, Dr. Piyush. How are you? And thanks for joining us.
Thank you so much. Hello to everyone.
So let's start with you, your rank, college, attempt, and a little bit about your journey so far.
So myself is Dr. Piyush Ranjan Mishra from SCB Medical College, Cuttack from Odisha. I passed in 2024 and this is my post-internship attempt. And I secured a rank of All India 345 in NEET PG 2025.
So how was your journey so far, like in NEET PG preparation phase?
The journey, actually I had started in last 2024 December. Was 2023 December. It was 2020 December from which I started my journey as a preparation. Actually, if I say my journey began from second year onwards only because I was a good student in college. Even I was my batch topper sometimes. And I am also a gold medalist in ophthalmology. So eventually I studied all the 19 subjects with equal importance from my UGDs. So my foundation was always strong. But what happened in 2024 NEET was I was unable to revise properly. But the major factor was I have migraine. So it was diagnosed in the second year and I took prophylaxis medications once in second year and once in fourth year. And after that, I had not, this migraine problem had not come before the exam. But like last year, 2024 NEET was, it was very disturbing. We had different places to go and give exams. So my exam center was in a very different place. And there, I got a very bad attack of migraine on the day of exam. And I just woke up and realized that there is no medicine shops nearby. And I had forgot my medicines also. It was left at home. Even a paracetamol was not available there. So I waited till 7 o'clock till shops to open, but there was no shops was open and I had to sit in auto and go to the exams. And the road was so bad that it, what I'll say, it exaggerated my migraine. And that 3 hours was, I think, the toughest exam in my lifetime. I was just hoping by 4th and 5th section, I was just hoping that I will attempt and go back. I won't think. I was not thinking about all the 4 options also. Whatever was correct in front of my eyes, I did that. So after that, I came back home. It was a very bad day and I had to take 2 paracetamol tablets, once at 4 o'clock, once at 10 o'clock to recover from that migraine. It was that bad. And I had a score of 143 correct that time. I was aware of the situation, what happened with me there, because I didn't expect migraine, but I could have gone with better precautions there. Since I know that status, so this time this preparation was along with studies to prepare for my migraine also. So I took prophylaxis 4 months ago, then exam 2 months ago, then exam shifted 2 months. Then I had to take 1-2 more months of prophylaxis and go with an naproxen tablet to the exam. So that in case I have a migraine also, I have to take it there. So this time the strategy was very different, that I have to study, I have to take care of all these things also which could happen on the exam day.
So if we'll talk about the NEET PG result day, so take us back to your day of the NEET PG result. What went through your heart and mind when you saw your rank?
I Before seeing any result, I think about Lord Jagannath and my father, mother, grandfather, grandmother, and my brother. I just close my eyes, think about them, then I open the result. Then when I searched my rank, roll number, I saw 345, and my hands were trembling. There were tremors in my hand. It was shaking, and I took 4 to 5 checks again and again. Once through PG roll number, once through application ID, that what I'm seeing is correct. Then I called my friend and asked him to check my rank through my roll number. He checked and confirmed that it is only 345. So it was a very big sense of relief. Even after saying the rank to everyone, 11 o'clock at night, also I checked again. That by mistake, did I see that 345? Told it to everyone. And for my personal satisfaction, even sometimes like 2 3 days back also, I opened the PDF and searched my PG roll number. So it is that satisfying for me.
Okay, so when you restarted your NEET PG preparation, as when you had very bad rank, I think 30,000 rank last year. So what was your strategy and how you thought it like I have to? What were your approach regarding the NEET PG 2025?
Yes. I know. I think the major confusion to every student now is there is over burdening of resources. Everywhere you see different persons following different resources. So the first thing I had to clear the confusion that what I am doing will be correct. So I had clear about that because despite a migraine attack, I did 143 correct. So I asked my seniors that I had a migraine attack, and I did after that also I did 143 correct. Suppose I didn't have the attack, I could have done 10 more questions correct, 153 at least. So that means what source I was studying is correct. Just I had to revise and keep there are less tests had appeared 2024. So my aim was to give all the tests that any test that is available to me, any test which is free to me in any app, and what app I am following, the test I have to complete that, and uh, just don't think about anything else, results and this migraine attack or anything that could happen on result day. If the exam may go bad, so all things I removed from mind. And my only purpose was to study, focus on the study only, and I have to improve my GT scores only. I'll just if I keep on improving my GT scores, that would give me a confidence that I thought and began, and eventually that happened. I saw that eventually during the last 2 months, my GT score boosted up. It was like 160 plus every time. 7 8 GTs I got 160 plus. Then there was a confidence. No, I can do it. So it was a journey of what I'll say multiple revisions. I did even last 3 4 months. It was very difficult to revise. That same things I have to read again. But then that is a challenge. That I have to read same things over and over again and keep testing myself. So I think that worked out very well because in the exams I was not thinking about what questions were there. It was my reflex response in the exam that I was getting the questions that I was seeing the questions I'm getting the right answers were coming to me. I think that reflex response should come to everyone.
Okay, so you like you told ki, you are also doing the job with your preparation. So on days when duties left you completely exhausted, what kept you going instead of giving up on your prep?
Okay. So I had I had some financial issues at home. So I had to join and mm, any postings I had gone. I think August was exam last year, 2024 August, and I joined a job in August 16, 2024. And after that, I continued job for 8 months. And within that 8 months, I managed OPD as well as emergency, but emergency was like the less patients. But OPD was I think around 100 patients came in a day. But emergency, there were less patients. The I went for a job where I got support from my staff also, and I took my books to the job also. There, OPD I could not study, but in emergency I used to study for 6 months, and I got a good rank in November INI 1000 rank, and that was a major confidence for me. That I got a 1000 rank in November. That means with job I got that rank. So even I've done field postings also. Like we have those recruitment of police officers where we medical officers are allotted. That postings we have done in 7 months. Some marathon postings also we have done. So I've gone to many places and all. But despite that, in a job I got after getting I contacted some of my friends who were at home and not doing any job, and they were able to study 8 hours in a day. So with the job, I was able to study 6 to 8 hours a day. So I thought that there will not be much difference, and just before exams I'll quit the job. But with the job, one moral value I got, that the less time we get for study, the more serious we'll be about studies. Like I give you 24 free hours, I can't study that much. If I give a 6 to 10 hours period of free hours, I'll study with more focus. So that happened with me after coming OPD. I had a regret that I had not studied today. So anyhow, I have to study till late night. So I think that job also helped in my preparation.
Okay. So, what role did community, peers, or mentorship play for you, especially when the things felt overwhelming?
Yes. In my job also, where went for a job, it was a community health center, and there I had seniors who had cracked PG, and they were in the job. So I asked them what all to do, and my mentors in SAB, who are in medicine now, and my friends who have also got PG in their first attempt, I've also contacted them, and like I was in a very good environment. My seniors were very good guiding, and my friend circle also, they're very supporting to me. Like whenever I want to relax, also I had a very good time relaxing with them. I could not remember. I was not that serious this year in terms of stress. I did not take this stress, and that's I only think because of my family and as well as a good circle of friends. I could not feel the stress. And as some teachers in Instagram, I would used to contact my app teachers. Whatever app I have taken, I used to contact them that I feel this is this, and my GT scores are not improving and all. They also sent the messages, and I used to study through these only. But I didn't see any of these topper interviews and all. I don't like that because everyone has a different strategy. So I thought that everything is different for someone. I used to see that before, but now I thought of why could not I have my own strategy. So I didn't watch that. Only mentors, friends, and seniors.
Okay. So, if you had to describe the role of Salaah played in your journey, what story or feeling comes to the mind?
The story, the best part of it was Dr. Akhil Tabe. And his session was the first one I don't remember. Before that, I don't remember Salazar's. That was the session. And that was the time when I first knew him. He has a Telegram channel also that is also very helpful. But Akhil Tambe sir's journey I saw from May I 3500 rank to a rank 6 or 12 around NEET PG. And my rank in May I was this year, 2025, it was 4000. So from November I 1000 to I dropped to 4000. So that was a bit disturbing for me. And then I came across Salaah, and there was Akhil Tambe's third session. And then I came to know that he jumped from a rank of 3,500 to rank 6 or 12 in NEET. I thought he also got a time of 2 months just because the exam was also postponed last year. So I just had a shot that this would work, that I had to some way to attend that session only. So I think the payment was I think 30 rupees or all, and that was also a concern for me that actually it's only 30 rupees now I can pay that also. So with that I had I think I remember sir's PDF that his presentation was very beautiful, and I had also that last part we had a one-to-one communication with him, and there also I asked him how to review the GTs because I had given around 30 around GTs, and sadly I don't remember what mistakes I've done in the first GT. So I had asked about that, like how to review the GT. So he asked me that you should review the wrong questions and the skipped questions only, because there is no time to recall and review the correct ones. And by that strategy, I could review the GTs easily. I skipped the correct ones. I only saw the wrong ones and skipped one. And I reviewed all the 30 GTs and maintained the wrong diary during the last 2-3 months. And that was very helpful. So I just remember that Salaah has played a very important role in my life. At least I had to come across a very inspiring personality of Akhil Dambe.
Okay, so many students hit a GT score plateau or stuck phase. So do you also face that, and how did you push through?
Definitely. See, there comes a phase where after doing everything, you don't cross 140. So that is very disturbing. I used to try and try, why is it not crossing 140? Then I have a friend who has got surgery names. So I asked him, as well as I think PT ma'ams also in YouTube also, both of them speak about the same, that maintaining the wrong diary. So there where I began 3 months before, I started preparing the wrong diary. All the GT wrongs I would collect and write. I'll made a diary because it has 12-month sections. So I divided each section into a subject. If it's a major subject, I'll give 2 months for that. And if it's a short subject, for a medium subject, I'll give 1 month for that. So like this January, February, March, I divided into subjects. I got 2 diaries, and in each after every GT, I used to write my wrong and skipped ones from that subject only in that month. I just struck down January and wrote their anatomy, and in anatomy, I used to write my wrong and skipped ones, and in very short way. So what happened during my second and third revision, I started with my wrong diary because I feel that every time we keep on revising the same notes, my eyes go to those things what I remember. I could not identify my weaknesses through reading, passive reading. So second and third revision, I started with my wrong diary first. That these are the things I don't know, or I did a mistake, or I'm weak in these areas. So I first did the wrong diary and then came back to the main notes or revision notes, which was my main source. I came back to that. So I think the only thing that can jump your GT scores is maintaining the wrong diary. You may not read it immediately, but eventually you're going to read it. You will make it a practice that last 2 months, 3 months, I'm going to go through this diary. So you have to start preparing a wrong diary, and only that can prepare, because many times we see the GT questions are repeated and repeatedly we do mistakes. That we can only identify through the wrong diary only.
Okay, so which subject or topic gave you the hardest time, and how did you tackle?
Okay, the hardest time is I felt anatomy. Because anatomy is very factual and I find it very difficult to remember. I don't get the relations what I was getting in first year. So what I did was there was very limited content for anatomy for me. I saw that there is only 4 to 6 questions in each from anatomy. If I'm able to do only 3 questions, also it's enough, because I have to give 100% to all 18 subjects. Anatomy is weaker for me, and it is very difficult to memorize anatomy. So I did only a small content, not a small content, adequate content. I didn't go for much in anatomy because I had if it's a tough question, it will be tough for everyone. I know anatomy. Like I felt the NEET PG 2025 questions of anatomy were also tough. But what I did, I had a target that out of 4 to 6 questions, I have to do at least 3 questions right. For that, I thought that my content would be enough. I won't go beyond that because I can't remember anatomy that much. So that was my purpose for anatomy. Rest on biochemistry was a weak subject, but I studied it properly and then understood the subject. Most of the subjects which I felt weak, they eventually became clear once I went through the entire subject. Not doing previous questions, not doing that rapid revision notes. I went overall through a subject and got a good wiring in my brain that I understand the subject, now I can memorize. So that way, most of the subjects became easy for me, like anesthesia, which was weaker, my biochemistry, anesthesia drug part, pharmacology, which repeated revisions, good hold of the subjects that helped me in my preparation. Only anatomy was the one which I had a limited content, so I had gone with prayer only that it comes from my content only. So I thought that there were 4 to 5 questions from my content out of 6 questions. So I could do that correct.
Okay. So if you give one message to those preparing right now, so what's the one thing you wish someone had told you earlier?
Okay. So, like in 2024 phase when I was preparing, I was hoping for a PG branch in my first attempt. There, I think I hadn't revised all the subjects as a whole. I just went through all the rapid revision notes, 2024. And I think that what changed in 2025 was when my mentor, my friend, he said that to get a good rank, like I always wanted medicine. To get a medicine rank, I can't go for the rapid revision content because that would only end in 10,000, 7,000, 8,000 rank. And in my college in SCB, at least you have to get a 800 rank to get into medicine, 800, 1,000 these ranks. So to get into these rank, I need to have a good hold over subjects. And suppose sometimes the exam becomes difficult also, I would be able to survive through that. And rapid revision content has been saturated, everyone reads that. So I have to master that also. I have to have a good hold of the subject. And one more is question solving, not QBank, but tests. The more tests I give, the more confident I become of myself. And recognizing my weaknesses, my weak topics, that all also help me. So, like, what advice I would give to anyone would be, I think it is first to trust the source you're reading. That's the first thing. I think that's a major confusion everyone is having. That what to read, this one, he's reading that, maybe that is improving, that topper is saying this has helped him, that topper is saying something other has helped him. So to get away from that, you just believe in one source that this I'm going to master. Then I'm going to appear for GTs. I'll see that it's not improving, then maybe my source is a little bit wrong or not adequate, I'll go for it. But first is whatever subject we are holding, whatever source we are holding, we have to master that. That is the first thing. Second is doing tests and improving tests only. And third, I'll say to have a confidence that everything will eventually go good if I do an honest effort. That I think honest effort will always pay off.
Okay. So thanks for joining today and all the best for your residency. And again, congratulations from Salaah side that you'll reach and your career will be more brighter and you'll get whatever you want in your life, and our well wishes with you always. So now you are part of Salaah family. So Salaah will be always with you. If you need any type of help, we'll always try to help you. And if you can join us as a mentor, so you can also join us as a mentor to help other juniors, those who are preparing for NEET PG and other competitive exams like IIT and other state and central medical services exams. So again, congratulations from our side, and hope you're going to do very well in your life. So all the best.
Thank you so much.